So the pelvic girdle is formed by four bones, two hip bones on the sides, sacrum and coccyx. These four bones are joined by two synovial and two symphysis joints. The synovial joints are sacroiliac joints, and symphysis is anteriorly the pubic symphysis and posteriorly sacrococcygeal joint. The symphysis joint is a secondary cartilaginous type of joint. So over here, this is the inlet part. So the plane of the inlet divides the bony pelvis into false pelvis above the plane and true pelvis below the plane. For descriptive purpose, the lesser pelvis is divided into pelvic inlet, pelvic cavity, and then pelvic outlets. The pelvic inlet is bounded by posteriorly promontory of sacrum, ala of sacrum, arcuate line, pectineal line, and then over here anteriorly pubic crest. Whereas the pelvic cavity is bounded by the pelvic surfaces of all the four bones, that is pelvic surfaces of the hip bone, pelvic surface of pubis, pelvic surface of ischium, pelvic surface of ilium, and pelvic surface of sacrum and coccyx. So pelvic surface of all these bones forms a pelvic cavity. So the boundary of the pelvic outlet is formed by anteriorly, this is a pubic symphysis, and over here this is a lower border of the pubic symphysis and pubic arch. This is a ischiopubic ramus and ischial tuberosity. So on both the sides, ischiopubic ramus, ischial tuberosity, and over here one ligament is missing, that is a sacrotuberous ligament that connects the ischial tuberosity with the sacrum and posteriorly tip of the coccyx. So the pelvic outlet is bounded by these structures. For the anatomical position of the pelvis, the pubic symphysis should be in mid-sagittal plane, and anterior superior iliac spine and the pubic tubercle should be in same coronal plane. For the quick comparison of male and female pelvis, pubic inlet of male pelvis is heart shaped, whereas in female it is round or oval shaped. And in male pelvis, the subpubic angle is very narrower compared with the female. The wider pelvic cavity and wider false pelvis and wider pelvic outlet of female provides ease of delivery during childbirth. Four types of female pelvis are observed. The first one is a gynecoid type. This is the most common type of pelvis in female. Next one is android type, and this type of pelvis base more resembles a male pelvis, and it's narrower than the gynecoid type, and it's shaped more like a heart or wedge as we discussed earlier. And the third type is anthropoid type. Anthropoid type of pelvis is narrow and deep, and its shape is similar to that of egg or upright oval shape, and it compresses sidewards. And last one is platypuloid. The platypuloid pelvis is also called flat pelvis. It is compressed anteroposteriorly, This is the least common type and it's more wide but shallow, and it resembles an egg lying on the side. And the platyploid pelvis can make the vaginal birth difficult because the baby may have trouble passing through the pelvic inlet. So these are the four types of pelvis which is observed in the female.